The stars are bright, we own the night. The stars are bright, we own. The stars are bright, we own the night. The stars are bright, we own. The
We're having a special episode of No Better Time Than the Present. I'm your girl, Yolanda. And we have a special treat. So, I know I didn't give everyone a long notice. Happy holidays. I didn't give everyone a long notice, but just rock with me. Okay, we're lucky that this has taken place. Oh, hello, let me put her on. I'm going to speak to Nadege Stevens, who's an RN nurse, and she, what's a good word? She cares for a lot of people who have multiple myeloma. So what better person to have as an expert who actually works with people with myeloma. So I just want to give a run through of the year. It's been a very interesting, fascinating year, whether with my mud girl, whether with No Better Time Than the Present, and just some other things behind the scenes that have been very cool. But 2024, we're ready. And whatever challenges are along the way with that, then it be what it be. Okay, but we are so already okay, and hopefully it'll be a even better year, you know. So tonight, as I said before, is a treat because first we're actually doing this on a Saturday, which I don't usually do this on a Saturday. And then the other thing is we have our guest. And hopefully this works the second time. As we wait for Nadege to come on, let me read you a little bit of her bio. So Nadege Stevens is a registered nurse for over 28 years with extensive knowledge and expertise in various fields of nursing. Currently as a nurse navigator and a clinical coordinator, focusing on oncology patients, in particular multiple myeloma, as well as head and neck cancers, sarcoma, brain cancer, and urological cancer. So again, we're fortunate to have her.
Thank you for the invite.
Oh, you're so welcome. I read your little bio. So, you know, with Instagram, we're going to have our conversation. I want to jump into the conversation because I want to, you know, be mindful of your time as well. So I think a lot of people already understand what is multiple myeloma.
Right.
Especially those that follow my page and all of that. But could you give like a clear definition of what it is for those who are still kind of don't know?
Okay, I'm gonna just like do really basic. So first I'm gonna explain like what plasma cells are because I think that's important for people to know what that is. Okay. You have, when you think about your blood, you have plasma. You know, you have your red blood cell, white blood cell, platelets that kind of float in your plasma. You call plasma cells. In your plasma, you make like antibodies. You know, there's certain things that fight off infection, right? So myeloma is basically cancer of those plasma cells, okay, that normally would fight off infection. Okay, so what happens is they over multiply. Okay. And although your body is making all these, reproducing and making all these plasma cells, they're actually not good plasma cells. They're not really functioning like they should. So it's a cancer. So you have an overgrowth of it. Okay. What ends up happening is that those plasma cells can also affect your bones, and everything can cause like fractures. Okay, so what essentially happens when those plasma cells are multiplying so much, and being that they grow in your bone marrow, and when you think about your bone marrow, it's inside your bones, they're overtaking your bone marrow, so you cannot produce the healthy cells because it's an overgrowth. You understand? So that's basically what it is. So you become anemic, and you become your platelets are not producing, and those things you cannot fight off infection. So that's basically what it is. It's kind of overcrowding your bone marrow for you to unable to produce the healthy cells. Okay, and they're cancer cells. Okay, so that's basically what multiple myeloma is.
Right.
Hmm.
It's funny because I can say, and I usually always started off with, well, especially specifically multiple myeloma, because that's what we're talking about.
Hmm.
It everyone, what I say is everyone is so different,
Very much so.
right? So sometimes it's not even about an age thing,
Right.
even though that can play a factor because it
Hmm.
depends,
Hmm.
um, but sometimes a younger person may have a harder
Right.
time than an
Right.
older person. So it really is an individual
Hmm.
scenario.
Hmm.
But I guess I'm gonna jump around from the questions that I have
Hmm.
to, because this kind of leads into what we're speaking about.
Right.
Hold on, where is it?
Don't mind me if
Um,
I'm looking down too, because I have some things written down as well in pro.
don't
So,
worry about it. Don't worry
I'll
about
make sure I get my facts right also,
it.
what I know and what, you know, so
Exactly, and we
yeah.
appreciate
Yeah.
that. Why is I guess you did speak of that, but why is this particular cancer unsettling in regards to the other blood cancers, and how important is today's recent treatments?
Okay. This cancer is very unpredictable. I think, with other blood cancers. It's also very hard to pick up. And I think that's the difference with it. I'll give an example. Where leukemia, you tend to kind of see it like right away with leukemia, because it's an overproduction like of leukemic cells. It kind of shows up in your blood work. Myeloma is a little bit more subtle. You know what I mean? You don't really pick it up, because the thing is, it usually gets picked up accidentally. Okay, because you may go for blood work and you see you're anemic, and a lot of things, and there's other things that cause anemia. It may not necessarily be myeloma. If you have other health issues going on, there are things that affect that blood work, so it's hard to pick it up. Okay, that's the difference, I think, with myeloma. And what tends to pick it up, a lot of patients do start complaining of like pain. That's usually the factor, the sign right there that usually picks up myeloma, is you may complain of pain, or for instance, you may fall and break something.
Right.
It may not have necessarily been a hard fall, but you broke something. And then when they go to do those x-rays, that's when they kind of see the myeloma in your bone marrow, because it's affecting your bones. That's the difference between myeloma and I think a lot of the blood cancers. It's very hard to pick up, and a lot of it gets picked up later. Or you can't tell with like leukemia and certain things, certain blood cancers right away. Myeloma is kind of a sneaky type of cancer.
Right.
Okay, right, right.
It,
Yeah.
and we don't like that
No.
because,
No.
as I've said plenty of times,
Mm-hmm.
I know for me, that's kind of what the call out is,
Mm-hmm.
just as you mentioned,
Mm-hmm.
blood work.
Mm-hmm.
It wasn't me feeling any kind of way. And I've always been anemic as a
Mm-hmm.
child.
Right.
So I don't, it's just kind of
Right.
like whatever, whatever. Who would think this is another indicator of something more
Right.
serious, if that makes any sense? So
Right.
just imagine those who don't do a
Mm-hmm.
normal doctor
Right.
appointment,
Right.
right? That was just, I guess, a fluke, or
Mhm.
just luck, to be quite
Mhm.
honest. I guess it was luck.
Yeah.
And I think it also, the doctor that I had, the primary doctor, as to push the envelope as to, okay, something funky is going on with
Mhm.
your protein level.
Mhm. Right.
So
Right.
here's
Mhm.
a off the cuff question, but how important is that whole primary care? Because for a lot of people who may be walking around with it,
Mhm.
right, it's that whole, who's the initial
Right.
person to catch this, because
Right.
no one's going to be at a
Right.
hematologist necessarily.
Right.
So,
So this is my advice to anyone whose blood work is comes back abnormal. My advice is, depending on what the blood work is, make sure that primary care gives you referral to somebody else who can go and study that further. So if it's I'll give an example. If you're chronically anemic for no reason, they don't know why, they should be sending you to a hematologist. Because then the hematologist is going to take it a step further and do additional tests, because they're going to want to find out, why are you so anemic? Okay, that will require more tests. If it's kidney, like, your proteins, your kidney functions are off, because myeloma can affect your kidneys too, that primary care should be sending you to a specialist that deals with kidney. Okay, that way those tests can be done further. I would encourage people to not, for them not to take the word, oh, it's just routine, you're just like, just push the envelope. It's like, well, I would like to go see someone, you know a specialist, to find out why. If you cannot tell me why, my labs are abnormal for that. So primary care, you need to have a really good primary care that's going to kind of investigate further and send you to the person who can give you some answers. Okay, so that would be my advice to anybody who has a primary care, that they find somebody that can, you know push the envelope, like you said.
right.
Yeah.
I think I think it's really a needle in a haystack,
Hmm.
if that's the right phrase,
Yeah.
because I was just telling someone the other day, I won't get into like the whole story, but finding a good doctor,
Hmm.
whew,
Yeah.
it's a lot.
And I agree. And you have to you have to trust your doctor, and you have to have a good relationship with your doctor, I feel, in order to express a lot of that, of those things. And I'll be honest, if they're not doing it, go find somebody else. You're entitled to a second opinion. You don't necessarily need a referral. You can go do your own research and go find somebody. you know Go find your own hematologist. Go on there, and and find out whoever's near you, and go see somebody who can probably push, investigate further. You have that
Exactly.
right as a patient to do that.
Exactly. And that's the thing that I preach
Hmm.
over and over and over and over again, is the whole self
Right.
advocacy, because it's important.
Hmm.
So being vocal about self care,
Hmm.
like what are some initial steps
Hmm.
that a patient should consider upon diagnosis?
Initial steps is, let's see, education. Make sure you educate yourself. Okay, do your research. Find someone who can answer your questions. Ask for second opinions. People don't know that. Please go ask for a second opinion. Okay, find somebody in your area who specializes in that. But I think, and I'm going to suggest this, because of the whole pandemic, is, right now video visits, telehealth
Mm-hmm.
is very big. And I know there are a lot of, depending on where you live, it's hard to access sometimes, I think, those specialists. But if there is a specialist in that, it doesn't hurt to reach out to those places and see if you can see someone, whether it's video visits, for at least a consult, for them to examine your blood work or anything. If you're being told one thing, and you may not understand it, ask for that second opinion. Find some way somehow to get that second opinion, for your diagnosis. Okay.
Kudos. Like everything you said is things that I know personally,
Hmm.
the trials and tribulations of what
Right.
I had to go
Right.
through. So
Right. Yeah.
Ditto what that you just said.
Yeah. And I will say, here's the thing too, a lot of people don't, a lot of people need to kind of tap into, there are, you know, uh, like I'm going to name some myeloma.org, MMRF, those types of places. You can reach out to them because they will give you like, they can kind of help guide you as well as finding specialists in myeloma in your area.
Right.
Right.
I mean, like, as you said, to educate yourself, the
Mm-hmm.
resources, they're really out there. And I think
Mm-hmm.
it's so different now
Mm-hmm.
based on when I was diagnosed,
Mm-hmm.
which was like many moons ago. I feel
Mm-hmm.
like the advancement of certain things is
Mm-hmm.
kind of like stellar to some degree.
Mm-hmm.
Um, how important is it to know the difference between a hematologist and a myeloma oncologist? And why is that so important?
Okay. So hematologists, I mean, they tend to treat a whole bunch of different types of, hematological disorders. A myeloma specialist, that's all they do is myeloma. So they're going to have the knowledge, the treatments and everything as far as myeloma. To me, I feel like a lot of them tend to have more up to date. They're more focused on that. They're more probably knowledgeable, a little bit more knowledgeable. I'm not knocking like hematologists don't, but when you talk about certain cancers, some people there are doctors who specialize, that's their specialty, and they will treat you, just like, and I'm just going to say, like, there's breast cancer specialists, there's lung cancer specialists, there's myeloma specialists, there's certain things. So it's good to go to get the opinion of somebody whose focus is myeloma. That's not to say that the hematologist still can't treat you. They can. One of the things that I do like, and I do see a lot of, is a lot of collaboration amongst doctors who may not, they're hematologists, but they do collaborate with specialists to treat myeloma patients, which is great, you know, because they're also, taking care of you, and they know they also have the top knowledge as far as, what can be done. It's also a way for you to kind of, I guess, get the top notch treatment. And then I'm going to also say, like, clinical trials. They kind of, those specialists, those myeloma specialists, they tend to have, a lot of knowledge and know the trials that are available for patients. That's why I encourage, that you see a specialist in myeloma, even though you do have a hematologist. We have a lot of patients don't live in a big center where all these institutions are, and they're local. So they do get treated by hematologists, but I also know there are a lot of hematologists who collaborate with specialists in certain areas to treat patients.
So, okay, so it's fair to say,
Mhm.
uh, I'm thinking of those who may not be in a big city, who may not
Right.
have certain resources or whatever. I think it's fair to say you somewhat hope that your doctor is
Hmm.
open for
Right.
thinking outside the box.
Right.
Now, so
Right.
that kind of goes back to the needle in the haystack,
Right.
because some doctors are not. Like the whole
Right.
collaboration as to, oh,
Mhm.
you should seek so and so. Like
Mhm.
my primary care doctor, him saying, oh, you should seek a hematologist. He didn't know anything about the whole myeloma, right?
Right.
So that's just the step of,
Right.
it's something related to the blood. So
Mhm.
that made sense. But with a hematologist, speaking oh, well, this is multiple myeloma,
Mhm.
and
Mhm.
you should seek a myeloma specialist.
Mhm.
That wasn't happening for this particular doctor. So,
Mhm.
like, as what you're saying is on point, but then it also, I feel like a lot of this kind of goes back to the patient. And
Mhm.
will the patient not even have that knowledge?
Right.
Will they be vocal enough to ask the right questions?
They may not, and that's the sad part of it. And I'll agree, there are patients who are not, who don't have the knowledge. They just kind of take the word
Mm-hmm.
of the person. And this is when I try to encourage patients, whoever's watching this, is to do your research. to go and look and go to the organizations that specialize in those, and they will tell you, a lot of it, to, like I said, again, come back to second opinion,
Right.
as for a second opinion,
And
you have the right.
let me ask you,
Mhm.
because sometimes, like, we speak of certain things, and I think some things kind of go over people's heads. So when you say, or if I say ask the right questions,
Mhm.
um, get the knowledge, exactly, like, name two things that patients should be asking or two things that they should be researching when they
Okay.
do Dr. Google or whatever
Yo,
that
yeah,
they
Dr.
do.
Google. First things they should do when you go to Dr. Google is you can't. Dr. Google gives a lot of information, and Dr. Google may tell you if you Google myeloma that you're gonna die in like 2-3 years.
Hmm.
Okay, that is not true. You need to go to the organizations that specialize in those special additional testing that needs to be done. Okay, what they need to ask: are there clinical trials available? Okay. Um, I'm trying to think. What else could we ask? No. I will say they should ask, is there a specialty center or someone that just specializes in this cancer?
Hmm.
I know I'm coming back to that, but that is the thing that they do need to ask. And they are going to go to Dr. Google. And if Dr. Google will show them, they'll show them all the information, all the doctors that do specialize in that.
Right.
Okay. It will also take them to those organizations that can guide them to those doctors.
Right.
Right. Okay. Um, Another question.
Hmm. Hmm.
Yeah.
So
Yeah.
since we hit upon that, what are some red flags? Again, like I
Red.
said, we're all so different in terms of being that
Right.
patient and that
Right.
patient doctor experience. What are, like, two or one red flag where, you know what, I'm out.
That,
Let
like
me get
a
to this
doctor, if a
person.
doctor tells you that you're out, like there's like, I only have one treatment for you. You can only, or you're gonna, you only have a few treatments. Red flag, or you're gonna die like in a year. Those are red flags to me.
It's funny, I made the face, but
Mm-hmm.
that's similar to the hematologist who I first saw, because that was
Mm-hmm.
actually similar to what he said.
Yeah,
You
and
have
I
you
will.
have
Yeah.
multiple myeloma, and this is what you need to do. This treatment right here.
Mm-hmm.
Like, it was very
Know your options. Know there are more options.
right.
And I don't want people to think that it's only one option. Know your options. There are multiple options. Um, for my multiple myeloma. And I will say, I was where I was at. I've had patients that actually came to us, and they were told by their local oncologist or a doctor that, oh, you're gonna die in a year. You know, barely gave them treatment. I've had that. And
Wow.
when they come, we're like, yeah, no, you're not. you know, you're not. We have treatments. You have options. You have lots of options. And I I I I treated this myeloma for years. I've been treating myeloma for years, and I do remember, the first treatments, there were like maybe not even in my hand, a few treatments, not even, and now there's like so many.
That leads
Yeah.
into another question.
Hmm.
I mean, like, it's such a turnaround where
Hmm.
we are in
Hmm.
2023 versus over 10 years
Hmm.
ago. Like,
Right.
my whole journey was way over 10 years
Right.
ago, from where we were then.
Hmm.
Like, my experience was talking about the drug thalidomide
Hmm.
to where we
Yeah.
are all the way in. As soon as, for me, when the
Hmm.
doctor mentioned thalidomide, that was my red flag as
Hmm.
well. Because I knew what that drug was.
Hmm.
Like, I'm not well versed as to whatever, but I knew that that was a drug used for other things that was not a good drug. And
Mm-hmm.
then here you're telling me that's your option for me?
Mm-hmm.
Second opinion.
Yeah. 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 That second opinion is important. Is very
Hmm.
important. You know.
So, what would you say? Because I know you mentioned before, in terms of clinical trials, like how
Mm-hmm.
important is that, and why should people consider that as an option?
It is very important. Okay. Because I think people don't realize like a lot of the drugs that they have now are through clinical trials. Okay. And the reason clinical trials is important is you get top treatment, upfront treatment of medication that could potentially cure this disease, you know. Um, Clinical trials are good also, especially in the African American community. This is why, because we also need to know how it affects us. You know, we need the data because not everybody's the same. You know, we respond really well to certain things, but we need to participate in order for us to tell how it affects us. And these are drugs that could potentially cure this disease.
Right.
Okay. So it's very important that you know about the clinical trials and also participate in clinical trials because it's a way to get the full total treatment and get the disease under control and potentially cure this disease. You know,
Right.
participation is key, especially in the African American community, because we don't participate in clinical trials. There is history there, we all know,
Hmm.
you know, and I know because of that, a lot of African Americans do kind of like, trail away from that. But a lot of times, this is probably what can help you and potentially cure you and give you the quality of life with these new drugs. Sure, eventually they will get approved, but what ends up happening is like the testing is, I think, so low with African Americans. A lot of times we don't have the data to see how we react to those drugs. You know.
Right. And that's kind of unfortunate because
Mm-hmm.
I think for those who do their little research and stuff,
Mm-hmm.
such as I did,
Mm-hmm.
when you see, oh, in 5 years,
Mm-hmm.
that's a wrap.
Mm-hmm.
But then I think when you're in it for a bit, as continuing to get knowledge about this particular disease,
Mm-hmm.
it's who, who are the people on these studies?
Mm-hmm.
And then kind of what is a clinical trial?
Mm-hmm.
And then if it affects, especially people of color, twice higher incidence,
Mm-hmm.
then why aren't they in these clinical trials? So that's like a storm of so many
Mm-hmm.
other
Right there,
questions of the
that we
why
can
and
go
all of
like,
that.
yeah, if we start that, because could be a whole lot of reasons why we're not in those studies. We also want to make sure that they're being offered to people of color. Okay, that's the whole thing. It has to be offered, whether you decide to go on it or not. But it should be offered to everyone. You know.
Right.
So, and this is where it comes back again. We're getting that second opinion and getting into um, people who specialize in myeloma. Okay, because they may, those centers, because they probably have those trials. Nothing wrong with you have a second opinion and asking about that and realizing that you're qualified for trials. I've had patients that were like initially, they had so many treatments and then offered that, and they're like, I don't know. I was like, you know what? This is what it is. This is the option. This is the reason why we're doing it. And I feel like a lot of times it's not explained. We need to explain to the patients exactly what a clinical trial is and what entails in that. They need to know we're not, experimenting on them. And we have
Exactly.
to explain to them step by step what the trial is and why we're doing it.
And
You know.
it's funny that you said that because that
Mm-hmm.
is that's what a lot of people think.
Mm-hmm.
And with them thinking that, it also goes back to what we originally said in terms of doing your research.
Mm-hmm.
That's why I was asking, like, what entails research, because a lot of people, they just kind of go with the flow.
Yeah.
So
Research
there is
is
that.
asking. Research is asking the questions. Is you know asking the questions and going to the reputable sites that actually has those, and reaching out to people who may have the same illness as you, because there are support groups. Getting involved with support groups, to know that you're not alone going through this. So it's good to talk to other people who also have this, so you'll know what to ask, because you may not know what to ask.
Right.
Okay. There's like Facebook has myeloma support groups. There's, and then, like I said, I've mentioned some other ones. There's support groups out there. So if you don't know how to ask, joining those sites actually could kind of help guide you as far as what to ask and what to look for. Yeah.
Right. It's crazy because
Mm-hmm.
I know I say this multiple times. I guess I'll say
Mm-hmm.
it again.
Mm-hmm.
If you don't fight for you,
Mm-hmm.
nobody else is.
Right.
And this
Right.
is not the time. And I know for me too, growing up, I was like a shy, quiet kid,
Mm-hmm.
nerdy,
Mm-hmm.
all of that kind of stuff. That has
Mm-hmm.
changed because now you're being told you have cancer.
Mm-hmm. Yeah.
There's no time to be kind of sitting there not saying. Like if
Right.
you're not sure what your doctor is asking
Right.
or saying to you, don't just sit and shake your head yes and
Right.
no. Just ask a question,
Right.
and just try to have a transparent conversation because again,
Right.
every
Right.
doctor is different.
Mm-hmm.
But yeah,
Mm-hmm.
you cannot be not vocal.
Mm-hmm.
You
Yeah,
really
you have
can't.
to be vocal. You have to be your own advocate, to get the care that you deserve. You know,
Exactly.
it's like everybody else. And I highly push that to all my patients. I'm like, be your own advocate. I encourage you to be your own advocate. Ask questions and just kind of push to get the answers
Guys,
that you need.
this person here is somebody you want on your team, okay? Because it's like you don't want your medical team to kind of shield you for asking
Mm-hmm.
questions or
Mm-hmm.
why are you asking that? Just do what I
No,
told you to do.
no,
You
no,
don't
no.
want anybody like that. You want somebody.
Mm-hmm.
It is a partnership,
Mm-hmm.
believe it or not. And
Mm-hmm.
I think if people think of their care differently
Mm-hmm.
than however they grew up or however their
Right.
situation is, where there's like this disconnect,
Mm-hmm.
just think outside of the box
Mm-hmm.
of what this partnership
Right.
is. Because I think
And
it
it's a
really is a
partnership.
partnership.
Yeah, it's a partnership between you and not only your doctor, your care team. Okay.
Exactly.
Yeah. Yeah.
Exactly. So as we get to wrap this up, there is a question because
Hmm.
I just saw like little okey dokes of it in my
Okay.
question.
Okay.
So, are there any theories how myeloma or most blood cancers come to light?
Oh, geez. Oh, geez. Theories. Oh, who knows? I've heard, they do say obesity, maybe, I know there's been increased incidents maybe with 911, you know, um, oh, goodness.
Can you
Yeah, I know.
say,
There's like,
because,
I've heard, I mean, I've also heard like, there's some genetics,
yeah, I was just
obesity,
going to,
smoking. I know they've done studies with like some, maybe like checking like diabetes patients, other comorbidities. Funny enough, like, one of the things I was also reading is like, it's a little bit more common also in African descent, you know,
mm-hmm.
so there's that. It's kind of hard to say. Nobody really knows.
I'm curious
Hmm.
because have you heard anything that it is correlated to possibly sickle cell?
No, I've never heard that.
Okay,
Yeah, I haven't heard that. Where did
okay.
have you heard that?
Well, I'm doing my own personal
Oh,
thing.
okay, yeah, I've never heard that personally.
Because,
I'll say I've never heard that.
okay.
So, yeah.
It was just something that I thought because I have a cousin,
Hmm.
cousin,
Yeah.
and had sickle cell, you know, a
Mhm.
younger person.
Mhm.
And then I was like, oh, okay. I
Yeah.
wonder if that is related, even though that's
No,
cousins
no,
down the
no.
line.
Because then, because sickle cell, you're kind of born with it.
Right,
Yeah.
right.
So I don't think so. I've never heard of that. So
Hmm.
yeah, yeah, I've never heard of that. Yeah. What else have you heard? I'm curious now. I'm curious now.
I don't know. I think a lot of people are just perplexed in
Hmm.
terms of how this comes about.
Hmm.
I know I've heard about the 9/11 thing,
Hmm.
and sometimes you'll listen to things and it's like you don't see yourself in some of these things
Right.
that they
Right.
suggest,
That's
like
why
the
I'm like, it's
obesity
it's kind of like,
thing,
that's why
like,
I'm like, I don't know, because I really don't.
right,
But I have heard like maybe obesity. I've heard now off the top of like maybe feel like I've heard something maybe back in the day, like with being certain exposures to certain things. That's what I've heard.
exactly.
Yeah,
Like,
yeah, that,
you just don't know what this,
yeah,
and
yeah,
it can be frustrating. I think
yeah.
anybody with any type of
Mhm,
chronic condition, cancer, whatever the situation
mhm,
is, it's kind of
mhm.
like that. Why?
Right.
You know what I'm saying? Now, I know for me, just to put some business out there,
Mhm.
when we talk about, for me, I would think my situation would be environmental.
Okay.
And the reason I say that is we lived by a cleaners,
Okay.
okay, when I was
Mhm.
younger. And I remember coming home from school inhaling all of
Okay.
that solvent
Mhm.
stuff and all of that.
Mhm.
And then being in the fashion industry,
Mhm.
all of this, I dealt a lot with outerwear.
Okay.
So we would have these PVC
Okay.
um, fabrication or whatever
Mhm.
come in,
Mhm.
and the smell of it is just like,
Mhm.
ooh, this is a lot going on. So for
Mhm.
me, I would think it's environmental.
Mhm. Okay.
My opinion
My,
based
you're
on
right.
my
Right.
experience,
You're right.
because
Right.
all the other things, like if you look at the checklist, the
Mhm.
obesity, okay, I'm
Mhm.
not obese.
Mhm.
um, and what's the other thing? I know genetics, that was a
Mhm.
question that I asked many years ago, and the
Mhm.
answer to that was no. But now that
Mhm.
seems to still be on the table, that
Yeah,
it
we
could
know
be
what they're
genetic.
doing. There's sometimes I think there's like studies and stuff with genetics, especially if you have like some people in your family who may have had
Hmm.
myeloma or any other disease, just like you test for the breast cancer genes and stuff like that. So I think probably, I feel like maybe there may be more testing probably
Right.
along those lines too. Who knows? Yeah. So, yeah.
Well,
Girl, it's a lot.
it's a
Mystery.
lot.
Yeah. It's a lot.
It's a lot, and it is a mystery.
Mhm.
And all you can do is keep trekking.
Yeah.
You know,
Yeah, being informed, doing your research, and keeping up to date with all the new treatments for myeloma. Because even like the past year, there's like two or three
yes,
things that's gotten approved. I mean,
yes,
right now, CAR T is amazing.
yes.
So that's what I'm saying. There's like so many options now.
You know,
I remember like even when died before daratumumab was approved. I remember giving the drug, one of the first
right?
ones to get in clinical trials, and now it's like a wonderful drug.
Exactly.
Puts patients from it. It's fantastic. It's great to see like from one end how things just kind of start out and see it approved and see how our patients do. That's great. I love calling my patients, and after one treatment, I was like, oh my gosh, your numbers dropped. Oh my gosh. That was just that's just fantastic to me. Or seeing a patient come in a wheelchair and 2 weeks later they're up and walking because the
Right.
medication's working. That's the beauty of like the treatments of myeloma and getting all these things approved. I just love seeing that my patients. That's just like the highlight of my just celebrating with them. You
Exactly.
know, you
And it
know.
is a
Yes,
celebration, right? Because
yeah.
like you read the
Mhm.
initial what it is diagnosis and this, that, and
Mhm.
that, and it's like, oh. This
You
doesn't feel
know,
good.
yeah, no, but you know what? I just root for my patients, and just so once they do that and they're in remission and they're doing all this traveling and doing all these things, and that's what we want. We want you to like live your life.
Exactly.
Okay, this is just a little bleep in it, but live your life. We want you to live your life and enjoy it. So,
Totally agree. And
yeah.
I'm about living my
Yeah,
life.
I do. I
Okay.
do know that. I do know that. I do know that.
And we
Yes.
know that the time here is so limited anyway,
Yeah.
even regardless of a myeloma or what
Well,
have
or
you.
whatever. Yeah.
So you really have to live it up. Live
Yeah.
it.
Yeah. Yeah. Live it. Yeah. I agree. Live it.
So as we depart, is there
Yeah.
any parting words that you would like to say?
Um, be your own advocate. Ask those questions. Don't be afraid to go out there and do what you need to do. And this is a disease that you can have a life. This is not the end of you can have a life. You can have a normal, long life living with myeloma. Okay. So anybody who's diagnosed, either recently or had it, you can go on living. There's so many options for you now, and I want you to stay positive, about that. I hope, join the support groups. That's very important. Okay. Because you do need, that encouragement, and like I said, I'm going to say again, live your life, please, and have fun.
Woo-hoo.
Yeah.
Thank
Okay.
you so much,
No problem.
Nadege, for this
You're very
wonderful
welcome.
conversation.
No problem. This is
Got
great.
for you guys who popped on, pop off. I hope you learned a little something. The replay, as usual, will be up on YouTube. Check on, subscribe, and all that good stuff. We had a
Mm-hmm.
wonderful
Mm-hmm.
2023, and cheers on
Yes.
for 2024.
Yeah.
Happy New
Happy
Year.
New Year, everybody. All
Thank
right.
you.
Bye.
Bye, Nadege.
Bye,
Bye.
Yolanda. See you later. We'll talk. Bye.
Okay.